10 common and often ignored signs of cancer. Did you know there are many early signs that could indicate cancer? These can prompt further investigation, leading to early diagnosis and greatly increasing your chances of survival or even complete recovery. For some types I'll mention, knowing the signs gives you over 99% chance of cure. That's significant, so it's crucial to pay attention, even for aggressive types like pancreatic cancer. In many cases, if caught early, you can have a much higher cure rate. So watch for these signs and symptoms, as this is how cancer often begins. All right, let's go through the 10 signs. Sign number 1 is extreme fatigue. That exhaustion when you get out of bed, you've just woken up, but you feel tired, like your legs are heavy. Patients often describe it this way. Why did I mention this first? It's one of the most common signs, but also because many people tolerate extreme fatigue, which can become more serious over time. Don't let it reach that extreme level. Why? First, any unusual tiredness should be investigated. It's not normal. Waking up tired or struggling with stairs you used to climb easily are signs to watch for. Compare it to your usual energy levels. Cancer can cause anemia, where red blood cells can't oxygenate your body properly, leading to fatigue. Other symptoms include pallor, weak nails, hair loss, and even heart complications. So, at the first sign of fatigue, it's worth investigating. Why? It could be a glucose change, which, if corrected, gives you a better chance. It might be a thyroid hormone imbalance. There are various issues, not just cancer, that if treated early, greatly improve your odds. So investigate when you notice any signs or symptoms. The second often ignored cancer sign is bleeding. This includes nosebleeds, blood in urine, or blood in stool, or darker stools, which may indicate bleeding where blood has been digested, medically termed melena. So you won't always see fresh blood. Also, besides blood in urine or coughing up blood, respiratory issues need investigation too. Bleeding always requires investigation, as cancer can grow and develop blood vessels. These vessels can often bleed, but I want to highlight sign number 2, which is also common, the other extreme. While bleeding can indicate cancer, the opposite is thrombosis or blood clots. Cancer can produce substances that make blood more prone to clotting, altering coagulation. If you had deep vein thrombosis in your leg, usually in the lower limbs, with no apparent cause, for example, you didn't have a broken leg, which often requires immobilization with a cast, which is a risk factor for clots, or you didn't have surgery requiring bed rest, which is another risk factor. If the cause is unknown or the doctor couldn't determine it, investigate for other clot-causing conditions. Another significant risk factor is smoking. Many smokers know it increases cancer risk, but it also raises the risk of blood clots. Any of these extreme cases require seeking medical help. Thrombosis or blood clots is a very dangerous condition. Sometimes cancer patients die from clot complications, not the cancer itself. You see, these clots can travel through the bloodstream to the lungs, causing a pulmonary embolism, a complication with a high mortality rate. Without aggressive early treatment, you often don't have much chance of recovery. So it's worth paying attention to this and investigating if there's anything causing it. Sign number 3, also frequently ignored, is skin-related cancer symptoms. I want to highlight an aggressive type of cancer called melanoma. Have you heard of it? It's a skin cancer. Pay close attention to the signs I'm about to mention. I'll show a picture and explain. For this skin cancer, watch for moles that grow in size. Moles that are getting bigger need to be checked out. But that's not all. Look for moles with multiple colors and uneven edges like in this photo. These moles are often raised, itchy, and may even bleed. So keep an eye out for these signs. Focus on moles that grow, as it's easier for non-doctors to spot. If they're growing, you need to see a doctor. Also, you don't necessarily need a dermatologist for an initial assessment. No. Often, a general practitioner can diagnose and refer you to a specialist if needed. I've heard this many times. As a GP, I'd ask patients about it and they'd be surprised. They'd say, "But you're not a dermatologist. Why check for signs?" Because GPs can also assess and refer to specialists when necessary. Let's change the idea that only super specialists can diagnose. Many cancer cases could be prevented if we knew these signs and symptoms. Number 4 is unexplained weight loss with no apparent reason. I'll put a number here to make this weight loss point easier to understand. Generally, we consider a 10% weight loss within 6 months or less without starting exercise or a diet as significant. You can't explain why it's happening. Like with thrombosis, there's no obvious cause. We need to investigate why this is occurring. Cancer can produce substances that alter your body, leading to weight loss. You might eat less or lose your appetite, which is another factor. Cancer can also consume energy as it grows, contributing to weight loss. You'll likely experience reduced appetite too. So we must investigate the cause of weight loss. As I treat many metabolic diseases that can cause weight loss, we must make an initial diagnosis. It could be due to parasites, for example. It might be diabetes, which in later stages can cause weight loss due to impaired insulin function, or in type 1 diabetes, where the patient lacks insulin, leading to significant weight loss, often more than 10% in 6 months. When the thyroid overproduces hormones called hyperthyroidism, it also causes weight loss. You ask if thyroid issues can cause weight loss, and the answer is yes. Patients often come in with a 20% weight reduction. This is very significant, sometimes even more. It's important not to let it reach that 20% weight loss. Seek help early, as we can often resolve the issue. And why did I include this item about weight loss? Because I often see various diseases, and sometimes I even diagnose cancer. So it's crucial to pay attention to weight loss or changes in weight. The 5th common sign of cancer is the appearance of lymph nodes. What are these? They're defense cells in lymphatic tissue that multiply and grow larger. This happens naturally when we have an infection, for example. It could be a response to bacteria. Have you noticed when you get the flu? Or when you have tonsillitis, do you feel swollen bumps in your throat or neck? Those are lymph nodes. But they can also swell without any infection present. This could be a sign of cancer. These lumps that grow larger without fighting an infection. Why are they growing like this? There are various types of cancer that can cause lymph node swelling, as cancer often spreads through lymphatic tissue. This leads to enlarged lymph nodes. If you notice small lumps in your armpit, groin, or neck area, seek medical help for further investigation. Sign number 6, which people often delay seeking help for, is progressive pain. For instance, a headache that worsens over days or months. You may have had headaches before, as they're common, but now the pattern is changing. You're needing more medication, and the headache often prevents you from doing daily tasks. This indicates a progressive pain. When I talk to patients with progressive pain, I always investigate if it's not something more serious, like a brain tumor in the case of headaches. But what's striking is that many delay seeking help. They think, it's just a headache, it'll pass. I've had them before. But note this key feature. The pain increases, you need more meds, and it still doesn't go away. This applies to other areas too, like abdominal pain that's getting worse. It needs checking. Sign number 7 is changes in bowel habits. I'll also include changes in swallowing when you're eating, for example. Difficulty eating could signal a mass or tumor blocking part of your digestive tract, like the esophagus. This might indicate cancer in the intestines, throat, or even esophagus. A key feature is swallowing difficulty, starting with solid foods and getting worse. Patients often say, now I have to blend everything just to swallow and eat. This is crucial. This differs from swallowing issues caused by neurological problems like strokes. Has anyone seen someone with this condition? If you've experienced it, share in the comments. It's unique, starting with liquids and progressing. Cancer-related changes start with solids and larger foods, then progress. Sign 7 includes bowel changes which can indicate cancer, like colon cancer. Have you heard of colorectal cancer? It's common and often causes bowel changes like constipation or diarrhea. Remember what I said about pattern changes. Compare your current state to your usual self. For instance, if you used to go to the bathroom daily but now only twice a week without any clear reason, that's a red flag. It needs investigating. Many people delay diagnosis. If colorectal cancer is suspected, a colonoscopy is the recommended test. Remember, A fecal occult blood test doesn't replace a colonoscopy. If cancer is suspected, don't waste time on blood tests. Go straight for a colonoscopy. Talk to your doctor. This advice could save your life. I often see patients delay diagnosis, which can be life-threatening. Let's move on to sign number 8, nausea and vomiting. Cancer can produce substances causing nausea and reduced appetite. This is a very common sign to watch out for. The ninth often overlooked sign of cancer is nodules that grow in size. I want to highlight thyroid cancer here, not because I'm an endocrinologist, but because this cancer type is increasing. If you have a thyroid nodule, seek help immediately. Diagnosed early, this cancer has over 99% cure rate. That's really significant. Remember I said some cancers have a high chance of cure? Thyroid cancer, if caught early, has a very high cure rate. Growing nodules anywhere need medical evaluation, not just in the thyroid. When I talk about a thyroid nodule, for example, I want to emphasize that many thyroid nodules are benign, not cancerous. For some reason, that area starts to grow and increase in size, but it's a change that isn't cancer. In fact, most thyroid nodules are benign. Okay? So if you have a thyroid nodule, I don't want to scare you with this video. I'm here to guide you and remind you that most are benign. And sign number 10 is an increase in body temperature, known as hyperthermia. This is different from a fever. Fever is a response to an infection or infectious agent. Hyperthermia, however, is increased body temperature without infection. This rise in body temperature usually happens at night. So night sweats, when you're sweating a lot at night, also need to be investigated. On a scale of 0 to 10, how would you rate this video? If it hits 10, I'll make more videos like this. Also, let me know which city or part of the world you're from. Now, I've got a video suggestion for you about fatty liver disease. Do you know the best foods to combat fatty liver? And which are the worst? Which foods should you avoid? Fatty liver, like cancer, is becoming increasingly common. So watch this video to learn more. I'm sure you'll find it helpful. Take care.